My name is Dr. Chris Jenkins, and I am the CEO of the Reptile Society and the host of the Snake Talk podcast, the podcast where you learn about nature's most feared, maligned, and persecuted animals. I invite you to listen to this conversation, and maybe you'll find that what you perceive as fear is actually rooted in a deep fascination. Welcome to the Snake Talk podcast. We have an exciting one today. I am here with Steve Barten, who is a veterinarian who has an incredible amount of experience working with reptiles and amphibians, and we have some mutual friends and kind of colleagues in conservation that we've both been working with for a long time who have connected us, and we've kind of, I've heard many things about you, and I'm sure you've heard many things about me, and we've emailed, but we've never actually met in person. And anyway, so I'm excited to be talking to you today, Steve. Welcome to the podcast. How are you?
I'm very good. I'm excited to be here. Like you say, we have a mutual friend who sings your praises, and I've been a fan of the Reptile Society for many years. Excited about everything that you do. So it's great for me to finally see you face to face and talk to you and get to know you a little better.
Yeah, glad to hear it. So, well, I like to start from the very beginning. As you know, I like to understand how people ended up getting into snakes and reptiles more generally. So how did this come about in you? Is it something from when you were really young, or something that happened kind of later in your career? But what's kind of the origin story for your interest in snakes and reptiles?
Oh yeah, I was that kid who had all the toy dinosaurs, and I could tell you everyone's name. And then I went out and caught a garter snake, and my parents let me keep it. And that was the start of my lifelong love of reptiles. I have a good friend, Dave Barker, who's a biologist, a zookeeper. He's a professional python breeder now. And we were out road cruising, field herping one time. And you have a lot of time to talk. And he said, have you ever thought about why we like snakes so much? He said, I put a lot of thought into it. And his answer was, it's because we find snakes beautiful. And everybody finds something beautiful. For my wife, it's orchids. For some people, it's birds or butterflies. For some people, it's Dutch master painters. Mm-hmm. Look at the girl with the pearl earring, beautiful use of negative space. But for us, it's snakes. It's their colors and their beautiful patterns and the textures of their scales, the way they move so efficiently without legs. They shed their skin. They don't have eye or eyelids. They're forked tongues. They swallow things bigger than their heads. We find that beautiful, and so we want to wallow in them. We go out and seek them in the wild. We keep them as pets. We look for pictures of them, back in the day in books and magazines and journals, and now online. And we just can't get enough of them because they're beautiful.
Yeah. Well, that's great. So it started from when you were very young. Did you realize also from that young age and having that love that, again, these animals are beautiful, did you realize this is something I could probably kind of incorporate into my career, or were you kind of moving towards something else career-wise?
No, absolutely. And my father and my grandfather owned a machine business. They built special machines. And I was very lucky that he allowed me to pursue my passions. And so I went to college. I went to NC State in Raleigh and studied zoology as my major. And I was lucky to be assigned a faculty advisor who was a herpetologist. And there's also the North Carolina State Museum of Natural History right there in Raleigh. And one of the grad students in zoology who I saw in the lab there also worked at the museum. His name was Alvin Braswell. Bill Palmer ran the museum. Bernard Martoff was my faculty advisor. And my best friend was a reptile guy in college, was Jerry Reynolds, who ended up working for the museum and still works for the museum. So I got to hang out with the museum people, go on field trips with them, just, wallowing in herpetology as much as I could. And then long about my third year of school, well, my advisor let me take a graduate course in herpetology when I was only a third year college student. And of course, I aced that because I just loved every second of it. But I started asking, what am I going to do with this degree in zoology? And I could go into academia, as many people do. You get a master's and a PhD. I could be a curator at a museum or a zoo. But most of those jobs are filled, and you have to wait for someone to retire, and then there's lots of applicants, and it's challenging to find meaningful work. Or I could be a veterinarian and get a job anywhere and work with reptiles, work with animals. It's science, it's lifelong learning, and it's making the world a better place. So I took that path. And you have to go to back in the day, there were only 28 vet schools in the United States and Canada. And so there was a lot of competition to get in. And you could only apply to the vet school in the state that you were a resident. And I'm from the far northwest suburbs of Chicago. And so I went to the University of Illinois. And back then, NC State didn't even have a vet school. They do now.
Okay. So even though you lived in North Carolina, you were technically a student, not a resident. You still had an Illinois license.
Yeah, I came from the Chicago suburbs. I picked NC State as kind of a fluke and a good thing because I met my wife there.
Mm-hmm. Excellent. Well, so you end up going back to Chicago and deciding to study veterinary science. And what was that like? Did you, as you went into that vet school, were you going into it thinking that you wanted to have some level of focus on reptiles and amphibians, or were you going into become your standard dog and cat vet, or what were your thoughts going into it? Were you going to preserve this interest in herps?
Well, in vet school, you have to study everything.
Yeah.
And I mean, I always liked dogs and cats. I still like dogs and cats, but I really wanted to study, reptiles as much as I could. But you have to study dogs and cats and horses and cows and pigs and, sheep and everything, poultry science. But back then, there was very little known about exotic animal medicine. In my 4 years of vet school, I had a 1-hour lecture on reptile medicine once. And there was one textbook on reptile medicine and surgery. It was 140 pages long. That's everything we knew about reptile medicine back then. And so I kind of learned on the job. And when I got out, I got a job in my hometown. Could be near my family, and I like my hometown, and I still live there. But I went around to all the pet stores and said, if you have any clients with reptile medical issues, send them to me. I know a lot about reptiles, and I like them. And I went to the local Chicago Veterinary Medical Association. I go to the meetings. I tell all the veterinarians there, if you have any reptile cases you don't want to deal with, send them to me. I love them. And most veterinarians didn't want to deal with reptiles and were all too happy to send their cases. And then I joined the Chicago Herpetological Society and became very active in that. Got to meet a lot of people there and got a lot of cases from there as well. So I started seeing more and more cases as time went on.
That's interesting. So there wasn't much training. Like you said, you had to learn over time, kind of on the job. I mean, obviously your training and working with other animals
your basic
helps.
medicine to reptiles. And knowing reptile anatomy and physiology, you can make those applications.
Yeah, that's interesting. But had very little training in it. And then you almost had to kind of go out and shop around to get the reptile business before it probably started coming to you. So do you know much about kind of vet schools today, and do people get a more significant training in, we'll call it exotics, or in reptiles, or are there maybe vet schools that specialize in that to some degree,
I think it varies a lot with the school and their faculty. Okay. And if they have faculty that are interested in exotics, then they'll develop, grad students and supportive staff to, help build up their exotics program.
Yeah.
So some like University of Florida, Tufts, University of Georgia have, just huge exotics programs, and some of the other vet schools less so.
Gotcha. Okay. So you moved back to your hometown, and did you open up your own like private practice? Did you start working at a larger kind of vet clinic? How did that kind of all start out for you?
I worked for a practice in my hometown for a few years and then opened my own practice with a partner and had that practice for, I think, 35 years until I retired.
Gotcha. And I'm assuming, the practice that you had with your partner there, it was kind of everything. While you might have had this interest in exotics, you were seeing dogs and cats and sheep and whatever else it might have been.
Yeah, we treated mostly dogs and cats. And again, I love dogs and cats. But I saw a lot of reptiles. And we had the Wildlife Discovery Center run by Rob Carmichael was nearby. And I got to do his reptile work. And boy, he had a big reptile collection. We got to see just great cases from him. What a great curator he was. He really cared for the animals. He'd do whatever was right. If we could help them, he'd do what it took to help them. If they had something that was incurable, he wouldn't let them suffer. But just a great owner and a great client. And of course, I'd cut him breaks. I'd see a case that was interesting that I'd want to treat, and I'd charge him. What can you afford to let me do this? For knowledge and experience. And being a practice owner, you're able to do that. Nowadays, so many practices are owned by corporations, and the veterinarians are employed, and they're not allowed to give discounts like that.
Okay. Well, before we start talking about your practice, and I just want to kind of talk about maybe some of the different cases and things you've seen, but just speaking about veterinary medicine with, let's say, reptiles in general, as compared to what most people or most vet work would be, again, on dogs and cats. Like, obviously there's the anatomical differences between these animals, but, probably the biggest, these physiological differences and things, the idea of being endotherms versus ectotherms. Like, what are some of the major differences you would say working between, let's just say, dogs and cats or mammals and reptiles?
Well, when you have a dog or a cat, most people pretty much know how to take care of them. And they know, balanced nutrition is readily available. You don't have to worry about proper temperatures. You don't have to worry about UV light supplementation. And what I saw in practice was kind of two populations of clients and cases. One was the less experienced people, and we'd have husbandry issues. So, improper temperatures, lack of UV light, unbalanced diets, lack of supplementations. You'd have, calcium deficiencies and vitamin D deficiencies. You'd have hypovitaminosis A in turtles and things like that. And then the other population was the experienced keepers whose reptiles lived to be very old, and you'd have reproductive issues, egg binding and so on, and a lot of then kidney failure and cancer when they got very old. Cancer is surprisingly common in older reptiles.
Yeah, I've had a number of reptiles that I've kept that have died from cancers over the years. So
yeah, colubrid snakes especially frequently get cancer when they're in their 20s and 30s.
Yeah. Well, I know it sounds like in the beginning you were really, you're kind of out there hustling to get the reptile work, if you will. But I'm just curious of all the cases throughout your practice and over the years, I'm assuming that the majority were for, pet owners of whatever, iguana, snake, whatever it might be. Was that largely the case, or did you ever kind of interact and work with other people who, you mentioned, I think Rob was his name, people that had large collections, maybe like a zoo type collection, or even like a more conservation oriented collection, or not even collection, but a conservation project that required vet expertise? Or was it primarily or exclusively kind of pets?
It was mostly private owners, and some of them were pets, but some of them were, had fairly large breeding collections. So again, the two populations. There was another reptile exhibit up in Gurnee Mills called Serpent Safari that had a big collection, and he went for giant reptiles. And so that brought in a lot of very interesting cases. Venomous snakes are illegal in Illinois. And for legal reasons, I wouldn't see any venomous snakes owned by private people, but Rob Carmichael had a big collection of venomous snakes. And so I got to treat a lot of his. Okay. And super interesting things, king cobras and rhinoceros vipers, bushmasters, all different kinds of rattlesnakes and things like that.
Mm-hmm. And so was his collection, that was primarily like a breeding collection, or was it like an outreach?
No, it was a nature center, but because he liked reptiles, it focused on reptiles.
Oh, okay, great. Yeah, so that's very kind of conservation oriented.
Yeah.
Vet work there. I like it. So you mentioned that, that it sounds like a lot of the cases stemmed from, or the big differences between the, reptiles and other taxonomic groups it really has to do more with the people, meaning that, we just caring for them wasn't as inherent or we weren't taught it as readily as we were with things like dogs and cats. So, that would kind of result in most of the cases. But what were kind of...
Well, and back when I started, there was no internet. And so people just didn't have access to information of how to care for these things.
Yeah.
And we used to have care sheets, we'd call them. And it would be a 2-page sheet with basic husbandry information, various species. But now people just look it up on the internet, when they want to find how, the care of leopard geckos or the care of you name it, alligator snapping turtles.
Yeah. A lot of vets end up kind of doing, I'll call it like rescue related work, where you have wild animals that for some reason are brought in from the wild. Maybe they've been hit by vehicles or hit by a lawnmower or just appear sick. I'm just curious if in your area, if you ever had that opportunity, if there were many snakes or other reptiles.
We see a fair number of turtles hit by cars, and we would treat those. And we bring them in and we tell the clients, if you want it back, you have to pay full price. If you want us to just, treat it and release it, where it was found, then we'll do it at our price. If you want to give a donation to help cover our expenses, we're happy to accept that. Mm-hmm. And if we could save them, we'd save them. Sometimes it was a female turtle that was mortally wounded but had eggs inside. We'd recover the eggs and incubate them and then release the hatchlings.
Oh, that's great.
Things like that. I had one client, though, they went down to Missouri and on a family trip, and their kid caught a little snake, and he got it into an empty Coke bottle, and he brought it home. And they said, well, we come to you with our dog, but we know you know a lot about snakes. Can we bring it in and have you teach us how to take care of it? And I said, sure, come on, bring it in. They brought it in. And I looked at it and I said, I'm sorry, you can't keep this. And he had caught a baby copperhead and somehow gotten it into the bottle and brought it home and didn't get bit. But this is where the nature center came in handy, because I donated to Rob Carmichael, and he kept that thing for 25 years. And it grew up and became one of his ambassador animals. Yeah. Another time, a woman was in Florida and she found a baby turtle at her campsite. And she thought, well, this poor thing, it doesn't have parents. It can't take care of itself in the wild. I better bring it home and save it. And she brought it home and she brought it in. I said, you can't keep this. It's a baby gopher tortoise and they're protected.
Oh, no.
But because it had been in captivity, you can't release it back in the wild. But we found a place in South Carolina that was able to take it and make it one of their ambassador animals.
Gotcha. Huh. Yeah, you've probably seen some pretty amazing things brought in. So, well, obviously you've treated a lot of reptiles, whether they be animals like that are brought in or people's pets. What would be some of you've talked about it with kind of the care issue in reptiles, but what were some of the most common types of cases that you encountered treating reptiles?
We call it nutritional secondary hyperparathyroidism, which is basically calcium, vitamin D, and ultraviolet light deficiencies, where they get soft bones. And the bones are like a bank for calcium. And so when you don't get calcium in the diet when you don't get vitamin D, which is necessary to absorb the calcium from the gut. And when you don't get the ultraviolet light, which produces vitamin D in the skin, they end up with calcium deficiency. And so then the body pulls it out of the bones for day-to-day living.
Yeah.
Calcium's used in enzymes and blood clotting and things like that. So the bones get softer and more rubbery. And that's probably the most common thing that we would see.
And what would
not so much in snakes because they eat whole prey that have vitamin D in the liver of the prey item and calcium in the bones of the mouse that they eat. But in, lizards and turtles and things like that, just a tremendous amount of that.
Yeah. And what would be some of the symptoms that, somebody would notice in their turtle if that was the case?
Misshapen shells.
Yeah.
The shell would flare up in the rear margins of the carapace. It would become flattened. It would become soft and pliable. Deformed limbs in chameleons and leopard geckos, a soft rubbery jaw where they'd have trouble eating. Very often just going off food is one of the first signs.
Yeah. And then you would basically recommend, I know some of those, I've seen turtles like that and those shells don't come back. Maybe you can correct me if I'm wrong.
Well, they're scarred. It's like acne scars in a human.
Yeah. And so
they heal and they get hard, but they're never the normal shape.
Yeah. So you basically, in a case like that, you would end up getting them, getting the appropriate light to the animal, make sure it had the appropriate diet and generally.
Yep. Calcium supplements, vitamin supplements.
Yep. Huh. Okay.
And it's amazing what they can come back from. Reptiles are tough.
Yeah. Yeah. What, so that's one of the major, you talked about egg binding as well. Talk a little bit about that. And, I know it happens more often as animals get older, but talk a little bit about that and kind of what it is for the audience's sake. And then, how you would deal with those types of cases. Hey everybody, I just wanted to take a break to let you know that you can stay connected to the Orianne Society by signing up for our monthly newsletter. Be the first to receive exciting updates on reptile and amphibian conservation, from the latest news and staff blog posts to exclusive announcements like upcoming Snake Talk podcast guests. Go to our website at www.orianne.org and sign up for the newsletter at the bottom of our homepage.
Normally an animal, a snake or a lizard or a turtle, normally would lay their entire clutch at one time. And so what happens is they lay a few eggs and nothing comes, the rest of the eggs stay inside and don't come out. Or they lay one egg now and, 2 eggs 2 days later and three eggs, 4 days after that. Or sometimes they've been gravid for a long period of time and they're not eating because their coelomic cavity is full of eggs and there's no room for the food. And the client thinks that the eggs should be laid and they just don't go ahead and lay them. And it can be pre-ovulatory. All the ova that are ever going to be in that female are in the ovary when they're born. And when they go through reproductive cycles, some of those ova will fill up with yolk. It's called vitellogenesis, and they'll become enlarged. Not all of them, but just some of them. And then at some point they'll ovulate and those ova will enter the oviducts where eggshells are laid down if they're egg layers or not laid down if they're live bearers, but they stay in the oviducts then until they're either laid or until the live young are born. And so sometimes the ova will yolk up vitellogenesis in the ovaries, but they never ovulate. And it's called pre-ovulatory egg retention. And in other cases, they'll ovulate, but the eggs get stuck in the oviducts and they're never able to pass them. And there can be many, many factors. Too cold, again, calcium deficiencies where they don't have muscle tone to squeeze them out, a torsion where there's a twist in the oviduct and it gets blocked, a blockage outside of the oviduct like an enlarged kidney pinching it shut, spinal damage, it goes on and on, infection in the ovaries. Mm-hmm. There can be many causes. So you have to figure out the cause if you can. In some cases, you can, if the eggs are in the oviduct, you can get them to go ahead and lay the eggs with induced labor with oxytocin, which is a hormone that causes the oviducts to contract. In other cases, you have to go in surgically and remove them. We had one client he was a reticulated python breeder, down in Indiana, and he came up from Indiana to the North Chicago suburbs with one of his prize breeders. She had laid 55 eggs, and she looked kind of lumpy. She was 18 feet, 10 inches long, and 165 pounds. And we sedated her and took x-rays, and there are 5 eggs left. And so we did full gas anesthesia with, endotracheal tube and gas anesthesia, heart monitor, and all that, and had to make 2 separate incisions to remove the 5 eggs and got them all out. And she recovered very nicely and went on to breed again. And I always, tell other veterinarians that it's the cool cases like that you remember at the end of the year, not, I saw another dog with an ear infection. It's, I did a C-section on an 18-foot, 10-inch python.
That's great. So that's what I was going to ask you, but you kind of answered it there. Like, how often, if, an animal is egg bound and you end up having to go in and operate, do those animals typically, are they done breeding or go ahead?
If they get egg bound one time, I suppose there's greater risk that they'll get egg bound again. So it depends on the individual. In lizards, if it's pre-ovulatory and the eggs aren't in the oviducts, they're never going to pass them. And sometimes you have to remove the ovaries, which renders them sterile to get those enlarged ova out. Mm-hmm. In turtles, it's usually in the oviducts, and boy, the oxytocin works best in turtles. Usually I give them the oxytocin injection and some calcium. Usually they pass the eggs in the car on the way home. It worked that fast.
Oh, wow. Okay.
In lizards, it worked kind of okay, but some of them had to go to surgery. And snakes, most of the time, they ended up having to go to surgery.
Yeah. Yeah, we have that issue, I don't want to say frequently, but it's not uncommon with indigo snakes. It seems like one of the issues breeding them in captivity. So.
Yeah, and they have those granular
Yeah, exactly.
things on the surface of the eggs, which makes them like Velcro. They kind of stick to the lining of the oviduct more than other species of snakes.
Yep. Yeah, exactly. Hey, this is a little bit of a tangent, but if you would humor me, I give a lot of public presentations about snakes, and, I talk about the idea of like oviparous versus ovoviviparous, and I guess there's viviparous as well. And you did such a good job there describing like ovulation and all that. I'm curious if you would mind kind of giving us, basically giving us how you would describe the difference between oviparous, at least oviparous, and ovoviviparous, but you throw in viviparous in there as well. But would you mind kind of giving us that lesson, if you would? I want to see if I'm wrong, basically. I want to see if I'm presenting it right. I'm checking myself here.
So again, there are herpetologists who are reproductive physiologists who know a lot more detail. And that's something that I've always tried to tell other veterinarians when I do continuing education lectures to veterinarians on reptile medicine is we think that as veterinarians, we know all there is about, reptile anatomy and physiology, but it's the herpetologists who really know about reptile anatomy and physiology, and they know much more than veterinarians do. So I just have, superficial knowledge of this. But again, for oviparous, they produce the eggs, they ovulate, the eggs remain in the oviducts, and that's where the eggshells are laid down. In ovoviviparous, they ovulate,
and then they lay those, the oviparous, then they lay those eggs.
Then they lay those eggs, right?
Yep.
In ovoviviparous, they ovulate, the ova go to the oviducts. They don't have an eggshell laid down, but there's a membrane around them. And I know in some species, and I couldn't tell you which ones, there's some kind of pseudoplacental maternal contribution to the nutrition of the embryos within those oviducts.
Yeah, I think like
it's very complex. There's
I think
so
like
many
anacondas
species.
Can do some of that, and there's some other species.
Exactly.
But that's the ovoviviparous part. Like a lot of them, the mother can't. She's not adding nutrients or taking away waste and doing those types of things.
There's a membrane around them instead of an eggshell, and then when they give birth, it's a live fetus now, live young with a thin membrane around it, and usually a little bit of yolk sac still attached with the umbilical cord. And then they break through the membrane and the yolk sac breaks away, and then you've got your live baby.
Mm-hmm. Well, good. I think I've been presenting that right. I end up presenting that quite a bit to people, so I'm just curious to hear you articulate it. But
now you mentioned your school talks, and again, Dave Barker does a lot of talks to schools, and he said he figured out early on that if he goes in and says, this is a corn snake and here its attributes, this is a king snake and here its attributes, he said nobody's going to remember that. So he came up with the 3 S's of snakes. And I've been using this in my snake talks. The first S is they're short. Mm-hmm. And, you're frightened of snakes and it's 6 feet long, but it's only 1.5 inches tall. And you're 5.5 feet tall. You're this towering giant over this little 1.5 inch tall snake. And no wonder it's frightened of you. The second one is they're slow. And even though they're undulating through thick grass that you couldn't get through, it looks like they're going really, really fast, but it's only a few miles an hour. And, a human could easily outpace them. They're not going to chase you down. Mm-hmm. You don't have to be worried about this, rapid snake getting you. And the last one is they're silent. And, people see a snake and they grab a shovel and they just start chopping it up. And he points out that, if you found a rabbit or even a mouse in the backyard and you started chopping it up with a shovel, it would be screaming. And that would just get to your heart. It would break your heart. You'd be going, oh my God, I'm torturing this thing. But snakes are vertebrate animals with a fully developed nervous system, and they feel pain and they feel fear, and they're intellectually a lot more complex than we think they are. And it's so inhumane to try and kill them like that. And the fact that they can't scream or let you know that they're in pain and scared and fighting for their lives, you just keep chopping them up and thinking it's okay, and it's not okay.
Mm-hmm. I like that. That's good. I've never heard that. So the 3 S's.
Yep.
Okay. Well, we've talked about 2 maybe more common, one very common, but types of cases. Do you have any examples of maybe kind of just interesting, maybe more rare or unique cases that you experienced over the years?
Yeah. Rob had a rhino viper once, and it came in because its gums were swollen so much that its lips wouldn't close. Now, everyone talks about snakes having mouth rot, and that just makes my blood boil. Mouth rot is not a thing. Okay. The mouth can only respond to disease in certain ways. The tissues can get swollen, they can become inflamed, it can produce pus, it can produce, scabby discharge, and that's about it. And whether it's caused by bacteria or viruses or fungus or parasites or, thermal burns or trauma or tumors. I've seen oral tumors. They all have similar signs. And if you brought your dog to the vet and he said, and it's shaking his head and his ear looks funky, and he said, your dog has ear rot, you think, well, that's not much of a veterinarian, right? So anyhow, this one, it looked like, we call it stomatitis, which means inflammation of the mouth, until we know whether it's a bacterial stomatitis or whatever. This one didn't look like the more typical infectious stomatitis. It didn't have the pus. It didn't have the discharge. It just had swollen gums that were very, very inflamed. And so I took a bacterial culture, but I took a biopsy of the muscle or the gum tissue as well. And we sent that off to be looked at under the microscope. And the pathologist came back. It was full of microscopic nematode worms.
Oh.
And so it was a parasitic stomatitis. And we could have given antibiotics by the truckload. It wouldn't have changed a thing. But we treated it with ivermectin and anti-inflammatories and recovered 100%. So again, it's a matter of getting a diagnosis, but that was a very unusual case. And then I had a green iguana. It was 19 years old, and it stopped eating for 4 days. And the owner brought it in, and it didn't look thin, but I felt its abdomen, and it was rock hard. I knew immediately what it was. It was a big bladder stone. I took it back to my technicians and said, I want you to x-ray this. It's going to be the coolest x-ray we've seen all year. And there was this huge bladder stone the size of a navel orange in a 4-pound iguana.
Wow.
And we surgically removed it, and I had to make an incision from the pelvis to the last rib, and even that wasn't big enough for the bladder stone to fit out. And so I actually had to cut one rib to make the hole a little bit bigger to get it out. but it recovered very nicely and lived for a few more years.
The stone was it was in the bladder.
In the bladder, yeah. And probably from chronic dehydration, a rainforest animal kept in an apartment in Kenosha, Wisconsin.
Yeah. Huh.
But she loved it and, did the best she could, what she thought was right. And when it got sick, she took care of it and was so thrilled that it recovered and did well.
Wow. Any other kind of, you think, interesting cases that the audience might be curious about?
Oh, gosh. There was a big alligator snapping turtle at Wildlife Discovery Center that had little papillomas on it. And instead of having him bring it in, I'd go and do, a house call. And just with a local block and a bucket over its head, we were able to remove these papillomas, and they were benign little things. We'd sometimes go out. The king cobra. I was doing an Easter brunch with my wife and my mother-in-law, and my phone went off, and it was Rob and his king cobra that he'd had for many years, over 20 years. It was sick, and he was really worried about it. And so I had to leave brunch with my mother-in-law and go treat a king cobra, which I was very happy to do. And
that's a great story. There's a joke in there somewhere.
And Rob was the only guy I really trusted with venomous snakes. He was very good at handling them, and we tubed it, and we sedated it, and we drew blood, and we took x-rays. And unfortunately, it ended up having chronic kidney disease. And boy, it's hard to treat a king cobra. In a dog, you'd put him on IV fluids or even subcutaneous fluids. But to catch a king cobra and inject it daily or even every other day is risky and stressful for the snake. It did end up dying from the kidney failure. And on necropsy, we found, just kidneys were just spent, very little functional kidney tissue left. But it had advanced heart disease as well. It had heart valve disease and an enlarged heart. And it had spinal arthritis all up and down on the x-rays, just from being an old animal. So it was sad, but interesting to, be able to work it up and find out what was going on with that.
Huh. Well, those are some interesting cases, and I appreciate you going through all these stories. How about, I know you've done, I guess what we call veterinary expeditions, meaning using your skill and expertise as a veterinarian, and then, going on expeditions, working with other people, whatever it might be, to work on, kind of far away exotic places, adventures. I'm just kind of curious if you could give us an overview. It doesn't even have to necessarily be snake or reptile related, but like, how did you kind of come about that, and maybe tell us some stories of places you've gone and animals you've seen.
Hey everybody, I just wanted to take a quick break and tell you about an urgent issue facing one of the most incredible tortoises on the planet. The Seychelles Archipelago, a crown jewel of the Indian Ocean, is home to breathtaking natural beauty and unparalleled biodiversity, but a looming threat now endangers one of its most iconic species, the Aldabra giant tortoise. A new luxury development on neighboring Assumption Island threatens to unravel centuries of conservation work, putting these gentle giants and many other species at grave risk. You can make a difference. A global movement is rising in defense of Aldabra's fragile ecosystem, and you can stand with conservationists fighting to protect one of the last great sanctuaries of the giant tortoise. Visit www.friendsofaldabra.org to learn more and sign the petition to make your voice heard today.
I'll take the long way in. So when I graduated and very little was known about reptile medicine, the guy who wrote that 140-page book on reptile medicine was named Fred Fry. And he was a veterinarian in Berkeley, California, and he also did pathology. And so I would send him snail mail letters with 2x2 slides of photos of my cases, and then I'd send him biopsies, and he would read the pathology and send them back and consult on cases with me. So he invited me to come and speak on reptile medicine at a big veterinary conference in Orlando, Florida. And I guess I did well enough where I got invited back to speak for a couple of years. And then I got invited to be the reptile program chair for that conference. And it was a 5-day conference. It was called the North American Veterinary Conference. Now it's turned into VMX, or Veterinary Meeting and Expo. It's grown over the years, but 5 days of conferences with overlapping sessions. There would be 3 days of reptile medicine from 8 until 5. There'd be 8 hours of lecture a day. So I'd have 6 speakers over the 3 days. Then we do a half-day lecture or a half-day lab, hands-on techniques on clinical techniques and surgical techniques. So got involved in all that, and then advanced to be their exotics program coordinator, where I coordinated the reptile, avian, small exotic mammals, wildlife, zoo, and aquatic medicine. And then I got to be the conference program coordinator, where I'd coordinate all of those, but also the small animal, canine and feline surgery and medicine, all the dairy, the beef, the food animal, the horses, and things like that. Well, the conference grew to be over 25,000 attendees from over 80 countries. And they were so successful that the CEO decided he wanted to host a conference on every continent. And my friend, Doug Mader, who actually was the editor of the reptile medicine and surgery textbooks, many of the veterinary listeners to this podcast will know of him. He was on the board at that time, and he raised his hand and said, "I'd like to do the first one, and I'd like to have this conference in Antarctica." And then he called me up and said, "Steve, you got to sign up for this conference. It has to be successful. If it fails, it's all on me. I want to make sure, have a good showing. This is my first venture into this." And he found a veterinarian who led expeditions, who'd been to Antarctica many times, and she reserved us space on a ship. And we flew to Ushuaia, which is the very southern tip of Argentina, and then took the Drake Passage across on a ship for 2 days to get to Antarctica, and sailed around Antarctica for 2 weeks. We studied conservation, the effects of climate change, the challenges of the wildlife down there with changing climates. We got to see everything in person. And I thought, what am I going to do in Antarctica? I can't see reptiles. I can't go scuba diving. But it was fantastic. And they talk about life-changing trips. If I had one trip that changed my life, this is probably it, because it got me focused on traveling the world to see iconic wildlife. You see all these wild animals in books, but to see them in their own native habitat. And I'm a photographer. That's part of why I got into speaking. I took, clinical pictures of the cases that I treated. So I had a lot of photos to rely on for my lectures and for publications. But I did wildlife photography as well. And photographing, the seals and the penguins and the whales and the albatrosses in Antarctica was fantastic. And it was successful. So the next year they went to Churchill, Manitoba to see the polar bears. And of course, the challenge is there. They gather on the shoreline of Hudson Bay, waiting for Hudson Bay to freeze up. They go out on the ice to hunt the seals. And it's freezing later and later in the year every year. So they're struggling to find food sources. But because they're there reliably, there's a tourist thing set up where you go out in tundra buggies and see the polar bears. Well, the next year we went to the Galapagos, and we got to see Lonesome George, the last Pinta Island tortoise in the world. And a few years after we saw him, he passed away, and that species went extinct, which really drove extinction home, made that conservation issue very real for me. But we saw the marine iguanas and the land iguanas and the blue-footed boobies and all the iconic things. We went snorkeling with Galapagos penguins shooting past and flightless cormorants swimming by you and marine iguanas swimming by. It was fantastic. We went to the Pantanal to see jaguars and hyacinth macaws and learned that ecotourism made more money for the locals than cattle ranches. We went to Australia and got to see the kangaroos and duck-billed platypuses and wombats and koalas, things like that. We hired a naturalist to take us out to Fog Dam and saw just oodles of water pythons. It was like garter snake aggregations.
Yeah, we've had
finally
Rick
went to
Shine
Rwanda.
and other people on talking about those areas, but go ahead.
Yep. And finally went to Rwanda to see the mountain gorillas. There are only 1,000 of them left. And we had lectures from the gorilla doctors, the veterinarians, zoo veterinarians from the U.S., and then Rwandan veterinarians who were treating them. The poachers would go out and set snares to feed their families, not to get the gorillas, but the gorillas get caught in the snares and they get injured and crippled and even killed. And now they're hiring the locals to be porters for the tourists, and they're making a lot more money as porters than they are as poachers. But we got to go up and see the gorillas. And there was one time there was a little baby gorilla, and he was hanging on a vine and thumping his little chest in just the most adorable way. And I was filming him with my iPhone, and I glance up, and there's a 450-pound silverback coming right at me.
Wow.
And they told us that if they do this, it's important that you be submissive. So you avoid eye contact, which is very aggressive, and you crouch down low and be all submissive. So I crouched down and I looked up with my camera and took a picture, and he's still coming. And I crouched down and I looked up and took another picture, and he's still coming. He sat down right next to me. So there I am with a 450-pound wild gorilla, where if I put my arm out, I'm touching him. He was that close, and it was just thrilling.
Wow. Did you?
So a lot of experiences like that.
Did you just kind of slowly move away, or how did you?
He slowly moved away. I think he was making sure that I wasn't messing with the baby. He thought I was too close to the baby, and the baby came to me. I didn't go to the baby. And the two of them just slowly moved away. And when they were a safe distance, then I could go in the other direction.
Gotcha. Well, that sounds like some pretty exciting adventures. But you've also, over the years, done a lot of more, we'll call them domestic adventures, and that even, outside of your career, in that, you would classify yourself as a field herper. Maybe just talk a little bit about, how did you get into that, and, what excited you about, kind of just recreationally getting out and looking for reptiles in North America?
Well, again, when I joined the Chicago Herp Society as a new veterinarian, a youngster, married but no kids at the time, we'd go out on field trips with friends. And I made very good friends, lifelong friends that I still go out herping with every year, all these many decades later. But we'd go to places like Snake Road in Southern Illinois long before anybody knew about it. But we were exploring down there, and we try and go on a big expedition at least once a year. So we go to Southern California, Anza Borrego Desert. We go to the Tucson area. Roger Repp lives out there, and he was our guide and would take us many places out there. Oklahoma, Big Bend in Texas, North Carolina, with my friends from college, South Carolina, Georgia, Florida, places like that. So just, a lot of field herping.
Yeah, that's great. Well, it sounds like quite a life. It's interesting to me. You've been able to take this love that you talked about early on for reptiles and amphibians, salamanders. I meant snakes, but probably salamanders too. And and
North Carolina is the hotbed for salamanders.
Oh yeah, no, I live right in the middle of it. So, and taking that love, and you've been able to weave it, through your career and through your recreation. It just seems like a real kind of center line to how you built your life. So that's pretty exciting. So one other thing I wanted to ask you about, this is kind of going back to talking about veterinary medicine and kind of like careers in, if you will, is I used to work for, long time ago now, but I used to work for WCS, Wildlife Conservation Society, best known for the headquarters of the Bronx Zoo. And we had a lot of kind of like wildlife vets on staff. So, people whose jobs, there were vets obviously that took care of animals at the zoo, but vets
I know several of them at the Bronx Zoo from our conference. Yeah.
And so I'm just curious if you could just talk a little bit about that. Obviously, it's going to probably be one of the more competitive career tracks within veterinary sciences, but talk a little bit about that, what those types of people might do, people working around the world on wild animals.
Well, there's a specialty in zoo animal medicine where you do internship and residency, it's an exhaustive exam to become board certified in zoo animal medicine, and some of that includes wildlife. many of these people are in academia. The ones that I know are in academia anyway. I know Sonia Hernandez is at University of Georgia. I know that there's a wildlife center on Sanibel Island called CROW, CROW. I forget what it stands for. And I know several of the vets there. They take in wildlife and rehabilitate them. They work on grants and donations and things like that. I'm sure that there are multiple jobs like that around the country. I don't have a lot of personal experience in that field, but there are certainly wildlife diseases like chronic wasting disease in deer that are a concern. Ongoing studies with that, lead poisoning in raptors. I know there are a lot of studies going on and concerns and trying to ameliorate these problems. Bird flu right now is the big one. They have to work together with the domestic veterinarians, the poultry veterinarians, and the dairy veterinarians, and cattle veterinarians that are struggling with these diseases. And then regulations and quarantines and, things like that, trying to head off these pandemics in the animal world that might spill over into humans.
Yep.
They call it One Health because the health that affects animals is the same health that affects humans. And all of these disciplines have to interact.
Yep. Great. Well, we've been going for approaching an hour now. It's gone very quickly, but I've enjoyed the conversation. It's been really entertaining and just learning about your life and all these amazing things you've done. I could almost title the episode, like stories in veterinary science or something, but we're going to start to bring it in for a landing here. And I'm going to ask you to tell one more story. Because as you know, I like to have all of my guests tell me a snake story. So I'm wondering if you would mind telling us your best snake story.
Well, one of my favorites happened on Snake Road in Southern Illinois. It's a place where it's a gravel road that runs along the base of a bluff, and they block off 2.7 miles of it with gates on either end for 2 months in the spring and 2 months in the fall because there's so many snakes migrating across that road. They brumate in the limestone bluffs, and then they disperse to the woodlands and swamps around them. And it's become a mecca for snake hunters. It's totally protected. You can't collect anything. You're not supposed to even touch anything or impede its progress. You can just look at it like you'd bird watch. So a lot of people go there now. But a number of years ago, I was down there with several friends, and we were walking along the road and poking along as one does. Some people were going up by the bluffs, and I somehow got ahead of my group. And so I was just standing by the side of the road waiting for them to catch up. And I heard this high-pitched peeping noise. And I thought, well, that's a funny sounding bird. That doesn't sound like any bird I recognize. Well, wait a minute, that's a rodent distress call. There's something eating a mouse. Well, we're on a place called Snake Road. I bet you it's a snake eating a mouse. So I'm looking and trying to see where the sound is coming from. I'm trying to triangulate, and it's off through the woods, under the trees. It's a layer of dead leaves. And about 20 feet off the road, I'm just looking the direction of the sound, and I saw one leaf move. So I walked over and I picked up that leaf, and underneath there's a red milk snake with 3 coils around a woodland vole.
Wow.
And so I just stood there. I had my camera and started snapping away, and my friends caught up, and we stood in a circle around it. We tried not to move, and boy, that snake wanted that vole bad. And of course, people who know snakes know that milk snakes have little tiny heads and little tiny necks, and everyone says they can't eat big prey, and you have to feed them small prey, and you have to be careful that you don't stress them. And this vole was huge for that snake. It looked like a python swallowing an adult deer. And we're all saying there is no way that this snake is going to get this thing down. Well, it took 45 minutes, but it got it down. And we took pictures of the whole thing and then watched as it slowly crawled away under the leaf litter again. So that was exhilarating.
Yeah, that sounds incredible. I'd love to see one of those photos. So,
well, they're on my website.
Great.
I've got albums for all the various trips. There's one called Snake Road, and they're in there.
Excellent.
But if I may, I've got a second story that is near and dear to you, I think, because it involves my lifer indigo snake, my unicorn snake.
Let's hear it.
Because when I was in school was pre-Endangered Species Act, and I actually got an indigo snake in a pet store. And I had it all through college and all through vet school and for many years afterwards. And it's always been one of my favorite species. And I've been out looking for them. I've been out with Joe Wazlewski in Miami, and I've been out with Bill Love in Florida, and just never happened to see one. Well, our mutual friend, as you know, likes indigo snakes. And he has a friend who has the permits and has access to private land, and he surveys the indigo snakes on that private land every year. And my friend invited me to join him one year. We went out with the guide to survey for indigo snakes, and there are gopher tortoise burrows everywhere, and we saw shed skins and we saw tracks, and we're hunting all day long. And my friend and I had a 3:00 hard deadline. We had to leave at 3:00 to get back. We couldn't stay any longer. And at 2:30, I turned to my guide and said, "The pressure's on, buddy." And he said, "Don't tell me. I know. I'm really feeling it." And not 10 minutes later, he and I were walking along side by side, and we look up, we hear rustling in the leaves, and there's the indigo crawling, through the glade. And it was, that unicorn effect, that thing you've been wanting to see for decades and decades and decades, and finally see it. It's a vision I can picture right now as I'm talking about it. And the guy just crossed his arms and looked at me, and kind of like, "This one's all yours." And I was heading towards a big palmetto thicket. So I ran parallel to it to cut it off. I had 2 cameras around my neck. I ran out from under my hat, but I cut it off, and it just stopped, and I just walked over and picked it up. And he processed as everyone. He took measurements, links, and weights. It had a pit tag in it that he put in the year before. He had caught the same snake 15 months earlier at about 3/4 of a mile away. It had grown 4 inches in that 15 months. And collected all the data. But what a thrill to get your unicorn.
That's great. Yeah, I love a good indigo story, and I've loved hearing all your stories today. So just want to, thank you for coming on the podcast today, Steve. I enjoyed the conversation.
Well, thanks for having me. It's a pleasure to meet you, and I hope I get to see you face to face, and hopefully you can take me out on some Orient Society property sometime and find some more indigos.
Let's do it. And I just wanted to thank the audience and tell everybody to remember, snakes are animals too, and it's a privilege to see one in the wild.